This VR project will be recreating the experiment done by Botella et al. On the treatment of claustrophobia with virtual reality. Many patients are fearful of in vivo phobia treatment, and there is a high dropout rate with in vivo treatment. Therefore, researchers looked into exploring possibilities with virtual reality. The authors hypothesized that from their experiment, they will determine the effectiveness of virtual reality exposure therapy designed to treat claustrophobia. This experiment looked at one single participant who met the DSM-4 criteria for claustrophobia or extreme irrational fear of confined spaces. This participant is a 37-year-old female, and this video will be recreating her experience during the experiment. The patient went through 8 therapy sessions over a period of 30 days in which she experienced gradual levels of difficulty. Each session would last about 35 to 45 minutes long. Before she began therapy, she was told to record her baseline fear record. This is a scale from 0 to 10, 0 being no fear, and 10 being extreme fear. And she did this over a period of 15 days before she began therapy. Once a therapy session began, the patient would begin in setting 0. This setting consisted of a balcony overlooking a small garden in a very open environment. During the session, the therapist would watch her progress through the environment via a monitor. The therapist would coach and make comments similar to comments made in traditional in vivo exposure therapy. Also, the patient's subjective units of discomfort scale, or SIDS, was documented every 5 minutes. The SIDS is a 0 to 10 scale measuring the individual's current level of distress and anxiety, 0 being totally relaxed and 10 being more distressed than ever experienced and cannot function. After the participant was ready to move on, she would next move to room 1. This room has easy door access with plenty of windows. There is furniture depicted in this room, and the color of this room is very light. Next, once the patient was ready to move up to the next level of the difficulty, she would move into room 2. This room has limited door access, and it is a much smaller room. There is no furniture in this room. The walls and floor are much darker, and the ceiling is lower. The most difficult and greatest intensity environment was an elevator. The patient was encouraged to enter the elevator at her own pace while being coached by her therapist. First, she would stand in the elevator with the door open. Next, once she was ready, she would attempt to use the elevator. This was the final level of difficulty in her treatment, and once finished, at this stage, the session was over. After the treatment was finished, the researchers examined her post-test fear levels. Then they conducted a 3-month follow-up. The results of this study are as follows. The patient's baseline fear level was about an 8 on a 0 to 10 scale. During the treatment, her fear level steadily decreased, with her highest level of fear being a 7 and her lowest being a 3 towards the end of the treatment. Her post-test fear response was 2, and remarkably, her 3-month follow-up was a 1 on the fear response scale. The authors of this paper conclude that these findings show support for the effectiveness of virtual reality exposure therapy for treating claustrophobia. However, the researchers discussed the limitations of this study, citing small sample size. Thus, more research needs to be conducted on virtual reality phobia treatment. Overall, this is a great example of how VR improved the life of this particular patient.